Hey there, it's Dr. Cammisa. Welcome back to our video series. And today you can see that there is a sea of machines behind me. And today's topic is on the power plate and some of the science behind the power plate. So I want to explain that. So if you're new to our video series, click the subscribe button below, hit the bell notification sign, give us a thumbs up because you like us, and I know you're going to like us. So stay tuned. I got lots to share today. Hey there, it's Dr. Cammisa. Welcome back to our video series. And today, as you can see, I'm sitting in a sea of power plates here. And so today what I wanted to do is describe to you why we have so many. We're probably one of the largest. I started in 2004. You can see I did a video several videos ago about the history of how I got involved with power plate, how that changed my spine and my back for back pain. But today is really about trying to explain to you, or not trying to, I'm going to explain to you how the machine works, first of all, and then how does it work in the human body, and then what are the results of the body responding to the vibration, and then what are the outcomes of that, and why do we use that? So first I want to describe to you the power plate. So the power plate is, you may have seen them in gyms, athletes have used them, and celebrities have used them before, but power plate is under the terminology of the category of whole body vibration, and it's also referred to as acceleration training. So when you look at the equation, you're going to see in a little bit here on a picture, but when you look at the equation of force is mass times acceleration. Traditionally, when someone's going to the gym, what are they doing? They're changing in that equation of force equals mass times acceleration. They're actually changing the mass. They're adding more weight to the bar. Acceleration is constant. We're on the ground here. We're not jumping. We're not falling, right? So we're only changing the mass. Well, in this particular piece of technology here, and we strive in our clinic here. First of all, we want to find out, why are you breaking down? Why do you have the problem that you have? Okay, sure, you got sciatica, you got low back pain, you got neck pain, whatever the situation may be. But why is that? Taking a medication, getting an injection to get rid of the pain doesn't tell you why. And it's only going to come back to bite you in the butt later on because you never figured out the why, you never fixed the why. So guess what's going to come back? And sometimes it comes back tenfold. So, all right, so we want to know the why. And then obviously the big question is where. So where in your spine you're breaking down. So the where and the why. And that's why we do such a detailed structural analysis. So assuming we get all that done and we get a blueprint of you, now we get you on the floor here, and then how are we going to change your decrepit, deconditioned, weak, and unstable body so that you can go live your life again, play golf, pick up the grandkids, go travel, do whatever you want to do, right? So let's talk about the machine itself first. So the machine itself is, when you look at that equation, force is mass times acceleration. Machine is manipulating the A in that, the acceleration. And you're going to see a chart here in a second. So the machine has frequencies from 30 hertz, actually goes all the way as low as 25 hertz. So it's the frequency of our muscle tissue, from 25 hertz all the way to 50. And then the plate goes up and down from 2 millimeters, which is a low setting, and to a high setting, which is 4. And millimeters doesn't sound very large, But when you actually are applying that in acceleration training and with a frequency, so the G-force, we're actually creating G-forces. So imagine if you were to jump off a step that's an 8-inch rise or a 10-inch rise, right? There's not a lot of force there. But then if you were to jump off a 10-foot ladder, right, there's a lot more force. That's more gravitational force being created there. So the G in that particular case is changing, or the A is changing. So let's stay on point here. So we have force as mass times acceleration. So you're going to see some video clips of what that looks like when I'm changing. I'm going to put a water bottle on the plate. You're going to see the frequency change from 30 low, 40 low, which is what we normally use, 40 low, which is 2.76 G-forces, and then all the way to 50 high, which is creating 6.3 G-forces. So you're going to see what happens to the water bottle. So as you can see, this is the water bottle just sitting on top of the plate. And now I'm going to take it through different frequency settings from 30 low, which is 1.83 G-forces, all the way to 50 at high, which is 6.3 G-forces, and you're going to see the difference. So here you go first. So this is 30 low, meaning the plate is moving up and down 2 millimeters, and you can see the water bottle moving. This is 40 low, 2.76 G-forces. This is the one that we use 95% of the time. This is the most comfortable for the spine, most comfortable for the patient. And you can just see how much more motion there is to the water bottle at 40 low, which is 2.76 G-forces. Now I'm going to do 50 high, and I might have to hold this one. So it's going to be 50 high, and you're going to see the difference. You can see how much more motion, how much higher that water bottle is, right? Whoa, we got it, man down, man down. So the machine itself just creates this vibration. So that's, and with the controls on the top and the controls on the bottom are just there to manipulate how much acceleration is actually happening to our body. And you'll see the chart there, all the way from like 1.8, just over 1.8 G-forces all the way to 6.3. So that's all the machine does. It just creates acceleration, it creates G-forces. Now what I want to do is talk about how our body responds to that vibration. We're going to take a human structure and put it on top of the plate. And so what that's going to do. So the minute you turn the machine on, and remember the machine's just creating vibration. So now when a human is on the plate, what happens when you turn it on? Well, the science behind that is the vibration from the plate creates what is called the tonic vibrational reflex. It triggers a reflex inside our nervous system. So when you hear the word reflex, what do you think about? Maybe a blink reflex? You think of the knee-jerk reflex or elbow reflex? You think of some kind of reflex. You don't have to think about a reflex. It's there to protect you, right? So those reflexes are automatic. They happen without you even realizing that, right? So the machine actually creates, that's the science, a tonic vibrational reflex. It's also termed as well as called neuromuscular re-education. So that's kind of the category in the therapy field now, is neuromuscular re-education. And what does that really mean? So let's think about this. Every joint in our body has sensors on them, okay? They're called mechanoreceptors, but I just like to call them GPS sensors. I like to keep things simple, right? So that means that if my eyes are closed now, if my hands are up, I don't need to look at my hands. Oh yeah, they're facing up. No, I can close my eyes and know they're up. I know they're down there. I know they're facing one another, right? And so it's those sensors in my joints that are feeding my brain the direction and what's happening here, okay? So those are mechanoreceptors. And so what happens is that when you stand on the plate, those mechanoreceptors are being stimulated. And that stimulation does lots of different things. So first of all, remember that there's a reflex being created. So those mechanoreceptors, and the other thing I was going to say is that joints have two major functions, right? So they have a range of motion they go through. Doesn't matter if it's an elbow joint, a finger joint, a knee joint, doesn't really matter what the joint is. The joint has two primary functions. I always get this mixed up. It's two. It's a two. It has range of motion and balance. So those are the two things for a joint. Range of motion and balance, okay? So when we look at what happens now, so you turn the machine on, you're staying on the machine, it's going to create this reflex. This reflex is going to go through your system. That system is going to then trigger a reflex. And that reflex is now tapping into your nervous system. So think about this. Someone comes into us who is very weak, deconditioned, unstable, which is the majority of people. Well, let's just say it's all people, because and it doesn't matter what they look like on the outside. You could have a 280-pound power lifter. No, someone wouldn't call him weak and unstable, but he has a weakness and an instability that's caused him to break down. So yeah, you could push the building over, but you ask that particular person to do particular function, they can't do it. So they compensate for that. Obviously, having grandma come in here, or an elderly person, or someone who doesn't exercise, it's pretty easy to see where they're weak and deconditioned and unstable. So let's continue. So we have these mechanoreceptors that are like our GPS system, right? So when you're on the plate, these are getting fired up. This reflex is then triggering our muscles to fire through this reflex loop that takes place through the spinal cord. We're not thinking about this, it's automatically happening. So the machine is creating this vibration. Remember, it's creating a vibration with a certain amount of G-force. And that G-force is calculated by how fast the machine is vibrating. And so we use 40 hertz. So let's just use this as an example, 40 hertz. It's the most comfortable. After all these years of being on the power plate, 40 hertz, your spine loves 40 hertz. Your brain loves 40 hertz. It's gamma waves. Your brain loves to be in 40 hertz. Your spinal cord loves to be in 40 hertz. That's why it feels great, right? So at 40 hertz, that's 40 times a second. We're going to use science now to retrain your spine. So when we have it programmed to 30-second sets, that's 30 seconds times 40 hertz, or 40 times a second. That's how fast the reflex is taking place. That's how fast the contractions are taking place, right? That's 1,200 contractions in 30 seconds. Think about that, 1,200 contractions. So here's where the neurology, here's where the science, here's where there's phenomenal technology dramatically transforms your spine and your muscles. Think of a conductor with a band in front of him, right? The band is warming up. What's it sound like? Irritating noise is what it sounds like. Irritating noise. As the conductor is pulling in different groups of instruments, right? Pulling them in. As the conductors bringing all these instruments together, it goes from this irritating chalkboard on the nails on the chalkboard noise to this wonderful, beautiful music. That's exactly what the vibration does to your body. So the vibration stimulates a reflex. The reflex is stimulating these mechanoreceptors. These mechanoreceptors are firing up in your nervous system. This nervous system is firing the muscle tissues. And so what happens is we get an increase in the rate of how the muscles fire. We get the increase, not only the rate, the increase in the number of muscles that are firing. Muscles that have been turned off because of old injuries, right, start to get turned back on. So we're strengthening the spine from the inside out, right? So we have increased rate of firing. We have the synchronization. That's what the conductor's doing. And here's the beauty of the science. When the mechanoreceptors get stimulated, guess what they do? They shut down the pain. Shut it down. Because the mechanoreceptors are 10 times the diameter of a pain fiber. So 10 times the size. So you have a hose, a 1-inch hose which would be, let's just say that's going to be your pain hose, and you would have a 10-inch diameter hose that's your mechanoreceptors from that is being stimulated. Who's going to win that one? The mechanoreceptors are going to win. So it shuts down the pain. It also, because those mechanoreceptors are being stimulated, it improves our proprioception. And you're going to see what's going to happen with that in a second. And then muscle coordination, and also, last but not least, it improves fast twitch muscle activation. So fast twitch, if you go to stub your toe, that's fast twitch. If you're going to go for a long walk, there's different types of muscles. I don't want to get into the physiology, but we have slow twitch muscles that you normally work out. If you go to the gym, that's all you're working out is slow twitch. It takes very specific exercises, very ballistic exercises that the majority of the population cannot do to train a fast twitch. You know what we have to do? I have to turn on the button. It's that easy. So we're using science to totally dial into your nervous system, totally change how your nervous system fires, totally change how your muscles are being coordinated and how your muscles are coming together, and lo and behold, your spine starts to function differently. So now I'm going to go through some of the benefits that a patient would see because of the neurology part of it. So we covered, that the machine vibrates, it creates acceleration. We covered that when a human stands on the platform and uses the platform, right, that there's a reflex inside our body, tonic vibrational reflex that gets triggered, and it stimulates it basically is like, remember, it's the conductor coming there, bringing everything together. Well, now we're going to tell you some of the benefits from that. And so there's 4 different systems that get activated. The neuromuscular system, obviously, the connective tissue, hormonal system, and vascular system. So think about it. If you were doing exercise as fast as you could, just as crazy as this, think about all the blood and all the different things that need to come and supply and regenerate your tissue because you're doing this. Well, I can't do 1,200 of these in 30 seconds, but the machine can help us do that, right? So, because of the mechanoreceptor stimulation, we get decrease in pain, right? That's the number one reason when people come in, and that's why these machines are so phenomenal. They decrease pain, right? We increase stability, right? Because we're increasing the stability, we're increasing the muscles that are being contracted, increasing stability, increasing coordination, because we're improving the firing and the synchronization of these muscles. We talked about, because it's improving, I mentioned this earlier, but because it's improving proprioception, guess what that is? Balance, fall prevention, great for seniors, great for anybody because it's activating also the fast twitch muscle fibers, right? Increase in balance, increase strength and power, that's obvious, right? Because force is mass times acceleration. If we're increasing the acceleration, we're generating more force. Well, from that is a great bonus, which is bone mineral density. So people that are suffering from osteoporosis, osteopenia, doing exercises on the plate generates increase in bone mineral density, right? And then last but not least, and there's other different little factors, but these are the major components, right, is increase in vascularity. So people that have diabetic neuropathies, your body needs blood flow. Blood flow is about healing. You need blood flow to heal, right? So I'm going to show you a picture. Now, it's a horse's hoof, but you're going to see a picture of a horse's hoof that is, obviously a horse is not doing exercise on the power plate. He's not, he's not doing squats. He's just standing in a stall, And but I want to show you what actually happens to the vascular system with and you'll see on the picture here, it's a 45-day pre-post, and you can see the dramatic change that takes place with the vascularity just from the vibration, and that's happening with the hormonal and vascular system. So as we go through this process of looking at someone's structural assessment and understanding where they're breaking down, why they're breaking down, and then we apply the technology of the power plate and the whole body vibration and the acceleration training, and we get them on the plate and we do very specific exercises that can help stabilize and strengthen the spine from the inside out. We have these phenomenal results that take place. And here we are trying to, I'm always looking, how do we get the best results? How do we get patients to have faster results, better results? And unfortunately, we are not a patient group of people, are we? We want instantaneous results. You might have had back pain for 5 years, and you come in and in 2 days it's not gone yet, and you question everything, right? But someone can go to a pain doc and have a dozen rounds of injections and they don't work, but they keep going back. So your body didn't get this way overnight. It's not going to change overnight. And so when we see someone, we want to really try and educate them. We're using the best science that there is, the best technologies that are out there today to tap into their decrepit, deconditioned, weak and unstable body. The body that they have been neglecting for all these years, waiting for the tire to fall off and they're in the ditch, waiting for the tow truck to show up. And yes, these are the people that we're working with. And so by using the technology, we get these phenomenal results, absolutely phenomenal. And I wanted to tell you, people that have come through our clinic are more stable, their posture's improved, lots of different factors in their life have changed and are continually to change as they come through here, and as I call it, plate time. The more plate time they have, the stronger, more stable, the healthier they are going to be. Now obviously we do adjustments as well. That's one of our main focuses because we've got to restore that nervous system. But the power plate, whole body vibration, acceleration training is an integral part of that's why there's so many on the floor here. All the patients are around here. It's an open concept. So as we empower people to live their best day every day, how do we do that? They want to do what they want to do, right? I'm not about, my goal is to get them to do what they want to do, to pick up their kids, go for a bike ride, go travel, go whatever it is they want to do. Go for a hike, go up and down the stairs at Starved Rock. I don't know what that's going to be, but I just had a patient do that, so that's why I know. So hopefully this made a little bit more sense. I'm going to go through some different exercises and things, but it's the science really that because you don't see it moving at all, right? So stay tuned for our next video. As we empower you to live your best day, we are continually empowering us to raise the bar so we can look for the things out on the marketplace that have the greatest effect on your spine, on your body, on your human journey. And I'm telling you, in 29 years of practice now, I have never seen ever seen a piece of equipment that will change a structure like a power plate, like whole body vibration. There is nothing like it. There is absolutely nothing like it. And when you know how to use this, and you know how to get patients to use this properly, the sky's the limit. So stay tuned, like our video, subscribe to us, turn on our notifications, stay tuned, give us a thumbs up, and we're going to share next time with you. Have a fantastic day.